Westmoreland Community Connections is a presentation of St. Anne Home.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce.
Hello and welcome to Westmoreland Community Connections. I'm your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce. I'm so delighted to have on the show today Michael Szwerc. He is a doctor at Excela Health, and he is the director of the Center for Lung and Thoracic Disease and this Advanced Lung Center at Excela Health. And Stephanie Scarlett, she is the coordinator of the program. Happy to have you on the show.
Well, Chad, thank you very much. It's really good to be back again.
Tell the listeners, what's your background and what persuades you to get into the medical profession?
Well, I think I grew up in northern New Jersey and went to medical school and college in St. Louis, Missouri. My wife's from Western Pennsylvania. We have two small children, and it's been a really enjoyable career. My main focus is cancer care, lung cancer treatment, lung cancer surgery. And I think being a physician, being in the healthcare profession is a wonderful opportunity to make a difference in people's lives. And I encourage that to kids that we meet today in school, that find a career that makes a difference. And I think whatever you do in healthcare, from being a nurse to being a physician extender to being a physician to being an administrator, you have an opportunity to make a tremendous difference. And it's a great career.
Stephanie, tell the listeners your background and what persuaded you to get into the medical profession.
Hello, I'm Stephanie. I'm the nursing coordinator of the Center for Lung and Thoracic Disease as well as the Advanced Lung Center. I grew up in Westmoreland County, and I have a passion for caring for others. Prior to coming to Excela, I have a strong background in cancer patients as well as critical care. So working with the Advanced Lung Center and the Center for Lung and Thoracic Disease ties in both of those.
Where did you go to school, and what is your degree, and how, is Excela having more employees and stuff like that? And we're looking at employers every day, and they are struggling to get employees and stuff like that.
I went to nursing school right in Westmoreland County at the Westmoreland County Community College, and I enjoy working with Excela. Excela not only cares about their patients, but they care about their employees as well.
Yeah.
Yeah, I think that's true. When I came out to Westmoreland County in 2015, the economic engine here wasn't the same as it is today. You guys have done a wonderful job, and you just see job opportunities up and down the 30 corridor here. And Excela is the same issue. We need help. We need help in all facets of our organization. Part of what we do is cancer care and take care of the elderly, and that continues today. And we need people at every level of care at Excela to participate, from nursing to physician to administrative levels. We're doing very well, and we do need help.
Living in the eastern part of the country, what is your perspective on how Westmoreland's healthcare is?
Prior to coming out here, I spent 10 years at a hospital called Lehigh Valley Health Network, which is a system in Lehigh County. A lot of people see it on Route 78 when they're driving to New York from here. And coming here and spending 5 years out here, I believe there are many parallels. We deal with similar patient populations, and the care we provide here is exceptional. I think the focus for most people is, can I get care close to home and not have to travel distances, not have to inconvenience my family when I'm sick? And I think Excela does a wonderful job at creating an environment that's a destination for complex care. It was once seen as a community system, but I don't think we see it that way anymore. We don't send patients away. We take care of them here. And I think the access that we create is wonderful for families.
Well, we're going to focus on the subject that you're working on. What is the Advanced Lung Center, and what are the purpose and screening and technology and stuff like that?
Within Excela, we created the Advanced Lung Center, and it is an organization that's designed around screening for lung cancer. Lung cancer affects many people within the United States each year, and the only way to diagnose lung cancer early is by lung cancer screening. We are currently approaching nearly 7,000 low-dose CT scans to date for lung cancer screening.
What's your perspective, Dr. Szwerc?
So in the United States, there's roughly 220,000 people that get lung cancer. Pennsylvania is one of the states with a high incidence of lung cancer. And I think in our experience, our cancer detection rates almost 2.5% out here, which is higher than the national average. So we have a population of older individuals, often older individuals who have smoked for many parts of the year, or their lives rather, and also who have worked in industries that are associated with lung illnesses, from COPD, emphysema, to asthma, to lung cancer. So you have the population is at risk for lung cancer because of age, tobacco consumption, and because of the environment that many of these people have worked in.
What causes lung disease, lung cancer, or problems with your lungs?
Right. I think the biggest issue is the lungs are filters. So if anyone's ever had the opportunity to change an air filter in their car or their air filters in their house, they see how dirty they get just in a few months. Imagine filters that you can't change and see that you breathe in dirt and dust and chemical pollutants in your environment your whole life. And so these are toxins to beautiful, healthy lungs. And if people live to 80, 90 years, that's 80, 90 years of toxins in the lungs. We know that secondhand smoke, environmental pollutants do lead to lung disease. So if you had the perfect world where there were no pollutants, then you probably wouldn't have much lung disease. Unfortunately, we have a lot of self-inflicted pollutants, including tobacco consumption, that have led to these kind of diseases. What we know now, though, is that if we find these diseases early through screening programs, we can make a difference. In the old days, people would say, you got lung cancer, it's self-inflicted, you're going to die. And what we say today is, no, that's not the case. Nicotine is addictive. The companies made it addictive. We want you to come in and see us, be screened early, so that, God forbid, you develop a disease, we can attack it early and make a difference in your life. The other thing that's really important is that lung cancer travels in families. So if you have a family member who had lung cancer, be very careful if you smoke. Come in and be evaluated because you should get screened. We see brothers and sisters with lung cancer, brothers and sisters who had parents with lung cancer. So that's a really big deal out here. And I'd encourage your listeners to really think about that and talk about it.
Tell the listeners, we're not going to audit it, but what percentage of the population has lung cancer? 1 or 30% or something like that. Do you have like 300 patients or, that have lung disease?
Well, let's look at it this way. So in the United States, 220,000 people are diagnosed newly each year.
Wow.
160,000 deaths in the United States each year. If you look at population trends, 1 in 5 deaths in the United States is linked to smoking and tobacco consumption. And nearly 1/3 of the deaths from heart disease are the results of smoking and secondhand smoke. The other thing that we know is that 85% of lung cancer is associated with tobacco consumption. We see in our organization over 4,000 people come through our offices each year.
Wow.
Here at Excela, over 4,000 people are coming through our doors just at the Excela facilities, the Advanced Lung Center and the Center for Lung and Thoracic Disease. And we're largely lung cancer-based program. This is not just people that have emphysema, asthma management. We have other organizations at Excela that see those patients themselves. But we began this program in 2016, and now we have over 4,000 people a year coming in our doors.
Wow. That's wow. It impacts Westmoreland County, and you have this project, or the thoracic disease and the lung center, and it impacts our community positively. You have the vaping stuff. Is it impacting our lung disease?
Interesting thing about vaping is that on parallel, vaping is probably safer than tobacco consumption across a population. So people say, is this safer for me? It probably is. There are over 300 chemicals in tobacco smoke that you don't get in vaping. The problem with vaping right now in our population is it is really not approved as a device to stop smoking. And what's happening is it's been targeted to kids to get them addicted to nicotine. So the vaping industry has been very clever. The biggest maker of vaping products in the United States is a company called Juul, and 38% of that company is owned by the makers of Marlboro cigarettes. And so they've used the strategies of tobacco consumption for years and have now taken that to the young and gotten them addicted by being very creative with social media, with marketing of certain flavors, cotton candy, these kind of things to target them. And these kids, unfortunately, don't even know that there's nicotine in these products. So they start using it, and it's a tragedy, because we know that a percentage of people that begin vaping will transition to regular cigarette consumption.
You're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. We'll be right back after these messages.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of St. Anne Home.
Welcome back. You're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. I'm your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce. Our guest today is Dr. Michael Szwerc. He is the director of the Center for Lung and Thoracic Disease and the Advanced Lung Center at Excela. And we have on our show Stephanie Scarlett. She is the coordinator. Stephanie, what do you know about the vaping in schools? That probably started, well, I know it started probably 5 or 10 years ago, but the kids in the schools are, I see them vaping.
Yes, unfortunately, there are more students vaping now in these local schools. In 2019, 25% of high school seniors will be vaping, and that's up from 2017, where 11% of high school seniors were vaping. And this is even affecting students in middle school. I have a son in middle school, and he tells me how often, just going into the bathrooms every day in school, there's always somebody vaping.
Wow. Middle schools? Mm-hmm. Wow. Absolutely. Wow. How do we facilitate this?
I think that unfortunately that the internet has made it all too easy for these young kids to have access. They have made devices that are easy to conceal vaping. They have things that look like a pen or a very small device, and it's hard for the average person to notice these devices.
Right, and the other thing I think that's important is that a lot of people have talked about vaping-related lung disease. So earlier this year, even at Excela, we started seeing people getting sick, coming into the ICU, having lung issues, what looked like pneumonia, but you could never really trigger what the cause was. Was it a virus? Was it a bacteria? And the link was vaping. And the link was using marijuana derivatives, often gotten not through proper pharmacologic channels, homemade substances that people were inhaling. And they were getting really sick, shortness of breath, cough, fever. Some people died. Over 2,000 people developed these illnesses this year, and over 40 deaths in the United States. And so the message has to be that all of this is dangerous. It is extremely disappointing in 2019 in the United States that we have companies directly targeting kids to get them addicted to nicotine. We got to be smarter than that.
Wow.
We should be smarter than that, and we're not. And number two, there are ways to get people to stop smoking. E-cigarettes may have some role, but right now the FDA doesn't approve them as smoking cessation devices. And last week, the American Medical Association just said all vaping should be banned in the United States until we figure this out. And so we have the tax interest, the revenue retail side of this. This is a $38 billion company, Jewel. They're making a lot of money, but they're harming our kids.
So the major cause of lung cancer is smoking, cigarettes, or vaping and stuff like that. What is the other cause of lung disease?
85% of patients who develop lung cancer have smoked or currently do smoke.
Wow.
Now, of that, then you look at the next highest risk. Radon is associated with the development of lung cancer in about 20,000 people in the United States. And then the third risk is occupational exposures, certain dusts from metal fabrication, beryllium, cobalt are associated with that. Asbestos is associated with that. So radon is a gas that people can get in their homes. So when you buy and sell a house in Westmoreland County, you have to check your radon levels. A lot of people that have lived in their house for 40 years never checked it. And they could do their laundry in the basement. They don't know that they're being exposed to that. So I always talk to people when we see them as new cancer patients, especially the elderly, check your basement and make sure. So those are the main risks. Smoking, number one. And what we're also seeing out here in Western Pennsylvania is a lot of never smoking women, especially in the 9th decade of their life, that either were exposed through industry, working in glass factories. And so, we're worried about that. We're definitely worried about that. And we're definitely worried about the family penetrance of lung cancer.
On another note, what does low-dose CT mean?
A low-dose CT is an image of the lungs that is used for early detection of lung cancer. This is a better picture than just a standard X-ray with minimal amount of radiation exposure, but able to look at abnormalities within the lungs.
I mean, who should receive screening, and the criteria?
Lung cancer screening is for anyone aged 55 to 77 with a smoking history of at least 30 pack years. That's 1 pack of cigarettes a day for 30 years or 2 packs a day for 15 years. A current smoker or a former smoker that quit within the last 15 years. And this is covered as a preventative service by most insurance companies at 100%.
Dr. Szwerc, what happens after the patients get the screening?
Right. So what screening is designed to do, and we'll go back to the very basics. A lot of people believe that smoking leads to illness. They know it. And it's a self-inflicted wound. Screening is designed to reduce the chance that someone dies from the disease. And so what we do is people come into our facility. They go through a brief discussion with one of our extenders, our clinical extenders, and then we find that they're eligible for screening based on the age of 55 to 77 and current or former smokers. They go right to the scan, And within 24 hours, we personally call them with the result. What I tell people and what we tell people is that there's a 98% chance that scan will be clean on the first scan. What's very important is that they come back each year until they reach the age of 77, because we know that what we're trying to do is find something. So there may be no cancer on the first scan, but the second or third scan may show a small growth, and that's when we can attack that, and that's when we can change the mortality of this disease. So it's what we promised people through our system at Excela is personal communication. Stephanie and her team call the patients. Stephanie and her team call the referring doctors and make sure everybody's aware of what's going on. And our other pledge is that if you want to come in and look at these scans with us, we'll show them to you. We want you to be part of the decision-making that we do on a daily basis as to why we're doing this kind of test, why we're doing this kind of biopsy, what we're thinking, and really engage the patient and their family in the experience.
If a listener is smoking or they have a family member smoking and stuff like that, why is cancer screening, lung cancer screening, so important? I mean, you brought it up, but tell the listeners why it's so important.
Lung cancer screening through low-dose CT scans is currently the only screening mechanism for lung cancer to detect it early.
But I'll give you the best answer in terms of numbers. 1 in 5 deaths in the United States, whether it's lung cancer, heart disease, stroke, are attributed to tobacco consumption. So 20% of the deaths in the United States are directly related to smoking.
Wow.
That's powerful.
Yeah. What makes your lung center different from others?
What we do at Excela's Advanced Lung Center is we treat every patient that walks through that door as if they were our family member. We reduce anxiety by calling these patients within 24 hours with their results.
What is your perspective?
Well, I think the proof is in the pudding of what we've done over the past several years. We've done almost 7,000 scans, and we've detected cancer. We've almost detected 80 or so new lung cancers in that whole journey. It's over 2%, 2.5%. I think people trust us. So once they come in the door, and God forbid we do detect cancer, they stay with us for treatment. They don't have to leave and drive far away and get involved with a new team of physicians or clinicians. We have wonderful radiologists who look at the scans with us. We have wonderful pulmonologists. And we have a wonderful hospital facility that offers the latest technology to manage lung cancer. There's nothing more you can get in any other system in the United States than what we have locally for people in Westmoreland County. And so that matters, especially in the wintertime. Who wants to drive an hour on ice in fog when you're 80 years old to go get treatment somewhere? And the truth is, the treatment locally, we have to make sure it's as good as what other people offer, but I know it is. And our data, our outcomes are benchmarked against anyone else in the United States, and we're really proud of the program we have.
Yes. What symptoms a listener has that you would suggest they schedule an appointment with you?
So when you look at lung cancer screening, by definition, we want people that don't have lung symptoms. So we're looking for asymptomatic people that smoke and are at the ages of 55 to 77. Now, the symptoms that we also want to see, but not for screening, but just for diagnostic workup are, hey, I'm coughing, and I've been coughing worse. In fact, I'm coughing up blood, and I'm losing weight, and I'm short of breath, and I'm having pain in my ribs or somewhere else. Those people need to be seen as well, and we put them through a different program. So lung cancer screening worldwide is about asymptomatic individuals, but the people that develop symptoms, we see them as well. We need to see them soon. And so go to your primary care doc and say, you know what, I'm coughing, and now it's blood. The primary care doc will do the right thing. We're happy to see the patients as well. We need to get them scans to look for things. We'll get them a CAT scan the day we see them. We'll get the insurance authorizations quickly, and we'll move aggressively through the process.
Obviously, you're impacting our community positively, but is lung cancer growing or decreasing?
What's changing is the mortality or death rates of lung cancer are declining, because I think all these kind of programs, the number of 220,000 a year has kind of been the number it's been for a while, which is good, because what we really have seen in our society is a reduction in tobacco consumption in the form of cigarettes. Unfortunately, let me emphasize that, we're seeing now all these kids becoming addicted to nicotine. So what's going to happen to these kids? We don't know, but they may be buying cigarettes in the not too distant future, and the concern is then you're going to see all these tobacco-related illnesses going up again. And so simply to make money, we're using drugs to addict kids. How crazy is that?
Yeah.
Isn't that sad?
It's very, very crazy.
Every time you pass one of those vape shops, I for your listeners to think about what's really going on, and these kids in middle school buying stuff at higher nicotine levels than cigarettes and getting addicted to the point where they have withdrawal symptoms, and they're running to bathrooms in the 7th grade and the 6th grade to use a vaping pen. It is ridiculous.
Yeah. It's sad.
It's so demoralizing.
It's so sad.
Yeah.
What are you going to, what do you want to have the listeners, this is the last question, what do you want to have the listeners, think?
I think that it's important to know that we are here to answer your questions. And if you even think that you meet criteria for lung cancer screening, to contact our office. We can sort through to decide if you meet criteria or if you should be seen by our Center for Lung and Thoracic Disease as well.
I think as we approach this holiday season, I'd encourage everyone to look around them, find a family member, find a friend, a neighbor who smokes, and really encourage them to get screened this year. We have, in the vast majority of the lung cancers that we have identified at Excela, they've been early stage and curable. And think about the power and how good you'd feel about yourself if you could get someone to go get a scan and they find something that's treatable and curable. So I think if everyone could think about that person they know, whether they go into the auto body shop and they see the guy smoking, encourage that person to get a screen, or your loved ones, or your grandparents, or your siblings. So please do that this year for your family and for yourself. We have a wonderful program here, and we thank you for letting us come out and tell you about it.
Well, thank you very much for being on the show. Dr. Szwerc and Stephanie, I thank you very much for being on the show and your impact, positive impact on our community, Westmoreland County, and beyond. Thank you very much. You've been listening to Westmoreland Community Connections on Hometown Classic Hits 107.1. Join us next week, same time, same place, for another edition of Westmoreland Community Connections. Thanks for listening, everyone.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of St. Anne Home.